Next, we have Stephanie Stamatakis, Director of Customer Engagement and Partnership Success at Dynacare Insurance. Dr. Joel Moktar, Orthopaedic Surgeon and co-founder of QuickChart. And Dr. Paul Cano, Family Physician and OntarioMD peer leader.
You've been someone who's embraced technology right from the start of your career.
Yep.
What has been the biggest barrier?
Probably the disjointed healthcare system. So the example for my own practice, on one day I use Acuro, in the hospital I use Meditech Expanse, which is their EMR. I run a virtual clinic where I use Talos' platform, and I work in another clinic where they use a really fancy EMR called Microsoft Word. It's all over the map. There's multiple different systems. I know you'd mentioned this before, but this is the challenge, is that the healthcare system itself is so broken. I know some provinces have a provincial EMR. I think PEI has this. Something along those lines would go a long way to help, because if you think about it, the same patient is being registered in all of those different systems. And then my billing software is a fifth system that we're registering the same patient in again and again and again. So there is no unified solution in Ontario. It would be great if we could move in that direction. That's why we see all these different solutions. But the pro to this is you get smaller companies that can innovate quickly in the space because there is room for that. Yeah, I agree. Many of them are physician-founded. Seeing all the different niches within the healthcare space where true innovation is happening. Many companies are Canadian, many companies based in Ontario. It's great.
I think the important piece for us is really just hearing from physicians one-on-one in an informal session about what their needs are. Dynacare Insurance Solutions are looking for ways to try to automate our spaces and make things easier for physicians, and rather than trying to guess what that looks like. A big part of why we're here today, and it's the first time Dynacare is at this conference, is really to have physicians tell us where we're not serving them in the process and how we can do better. But also great to see Ontario-based organizations that are really focused on physician needs, especially around health tech.
What area of digital health transformation are you most passionate about? Dr. Moktar, you're an orthopedic surgeon.
Yeah.
Right? So are you streamlining the receiving of the referrals or the sending, or is it the same thing?
It's mainly the receiving them. We get a lot into our inbox. It requires a manual review. My assistant has to enter the patient data manually, all the demographics. Then we review the referral, the information, the history, right, the imaging. There's a whole package that comes for every patient, and the format is different for every referral. So it requires a lot of hours of my time and her time to go through these referrals and triage them appropriately. So I think a solution in that field is definitely needed.
Is it a tech solution? Is it a quality information solution? What do you think? Is it both?
I think it would be a text solution to start with, like something that can just digitize the information right off the get-go. A lot of faxes are now digitized, so they're coming in like SR Fax at Unite, but there is still some paper referrals that come in as well. So something that can digitize everything and display the data in a text format or digital format rather than a PDF fax format.
For me, it's the reduction of administrative burden on primary care, particularly comprehensive primary care. I'm kind of fading out in primary care at the end of my career and not seeing folks take up that job that I have loved, and for good reasons for some of the things. I'm very passionate about reducing that administrative burden, whether it being easier referrals through e-referral, whether it being scribes, whether it being AI automation of a bunch of repetitive clerical tasks that we've got to do. And then beyond that, regulation that says this form has to be done by a physician versus which sucks up our time.
I think there's a lot of different perspective, right? You can ask the question 100 different times and get 100 different answers of what a perfect world looks like, and really finding a way to collect all that feedback and unify it in a way that it works for all. Surprisingly enough, we've done surveys in the past to very targeted groups that actually would argue that they prefer fax as an engine of communication, whereas some of the physicians who would attend a session that's kind of tech-based in nature would probably have a different form of opinion on that processes. So it's really just making sure that we're not fixing a solution to some physicians that may not be broken, but also really evolving and helping integrate solutions that will work long-term and facilitate the administrative tasks for everyone involved. I think that would be the biggest kind of roadblock. The other thing is really just adoption. As great as tech can be, it can be very scary. Change can be scary sometimes, and some of these evolutions can be scary. So helping people adopt and really see what's in it for them, once we do form a solution, is probably one of the things that would come as a roadblock or a need for enhancement.
I'm going to throw it maybe over to you, Paul. Getting them open to
Adoption? Yeah.
Because as a peer leader, that's something that you focus on.
Right.
Do you encounter hesitancy, or by the time that you are with a clinician, they've already passed that?
No, there's definitely hesitancy because our tools and solutions are often very disconnected or that their own thing. So for instance, at the start of my day, I love using a scribe, I love using electronic prescribing, and if records ended up in my EMR because we're a bit disconnected, I love going on to website portals such as Connecting Ontario or Clinical Connect to grab it. But all four of those things require a separate login and appropriately two-factor authentication. We got to make sure it's security. But boy, so when you're selling this to other physicians, oh yeah, it's another login. Oh, forget it, That's one barrier. Or it's another set of things that I've got to review this document that's 10 pages and legally. And I know somebody's vetted it, great, but still, we got to unify it so that we're doing it in one process when we onboard physicians and clinicians.
So it can it could feel overwhelming for someone to take on something new because of there's no single sign-on, or that's elusive, or long legal agreements is what I'm hearing.
And even when it's like an example we heard today, we're so busy putting out fires that we don't want to take the time to install that sprinkler system because of all you got to do to install the sprinkler system.
It's a hard problem. Yeah. How do we solve the time problem, guys?
That's a good one.
I mean, the big thing that we see is that physicians trust each other to a high degree. And if you have one physician champion who's figured out a certain tool and he's spreading it to their colleague and their network, that's how growth and how change happens. So it's good to see OntarioMD identifying those key peer leaders for that growth of this technology.